Welcome to Future Sense Now, where we explore the landscape and byways of our shared futures. An e-zine of the Futures Forum live online. We exchange ideas, information, and inspiration about the futures we want. Get Future Sense Now with host Dr. Claire Nelson, futurist and editor of Human Futures.
Greetings and welcome to Future Sense Now, an online e-magazine of the Futures Forum. April 7th is World Health Day, and we find ourselves in the middle of a global crisis. Yet, we want to focus our sense not just on today's crisis, but on what about tomorrow. We want to have a conversation on healthcare futures for the developing world, countries in Africa, Caribbean, Pacific, the Middle East. Specifically, we want to examine how we might continue that forward march towards health for all by the year 2030, as requested or required by SDG 3, in spite of where we find ourselves. Sustainable Development Goal number 3, which focuses on health for all, talks about ensuring healthy lives and promoting well-being for all at all ages. Health for all people all over the world, as this is a very important part of sustainable development. We know we're talking about communicable diseases like tuberculosis, HIV/AIDS, polio, malaria, and now COVID-19. But we also are talking about chronic diseases that have to do with universal health issues of tobacco control, smoking, road accidents. It's a broad band of things. Nonetheless, what is important is really the three aims: better care, better reliability, better accessibility. And it takes into account the fact that many countries have a ways to go to catch up. And so to have our conversation today, I'll be speaking to YAYA MBAOUA, who is the CEO and founder of the MBAOUA Group out of Côte d'Ivoire. And I'm very excited to talk to him because of what he's been doing as a returnee, quote unquote, an African diaspora who decided to go back home and do his part to make a change in the healthcare system. His company is a Healthtech company, and there's so much more to learn. Let's jump right into a conversation with me. I call you Yaya. It's such a cute name. Yaya! How are you?
I'm doing excellent, Claire, and thank you so much for having me. It's an absolute privilege for me to be speaking with you, and thanks for the opportunity, by the way.
Yeah, I was very excited. I've been doing research on these healthcare futures and really thinking about, you know, even before this this crisis, I was thinking, well, what would I do this year? Because I have this vision of really using these world days to have global conversations. And I was thinking about how would I deal with the healthcare futures agenda, what people are doing in health tech from blockchain to AI. And so I was just absolutely delighted to find your company at the forefront of making change. So tell us a little bit more about the company. It's health tech, but what exactly is it doing?
So the company is actually focusing on healthcare technology in general, but there are several areas in which we're actually focusing. So the number one area we focus on is telemedicine, telehealth, which is what we actually started doing nearly 4 years ago when I moved from Washington to Côte d'Ivoire. And we've gradually sort of, took on additional, challenges, namely improving, the health supply system in some countries in Africa. So the supply chain systems for, delivering medications in public hospitals. And also, obviously, we looked at building a platform by way of an app for patients in Africa to be able to connect with doctors anywhere around the world. So our mission really is to improve access to quality care for all people in Africa. So that's in a nutshell what we do.
Excellent. So your platform then is a telehealth, just to make sure I understand you, your platform is a telehealth company. You're partnering with, I guess, patient centers around the world, or do people reach out from their homes?
Yeah, so the telehealth platform that we have, which is one of the pillars, the three pillars of what we do, essentially provides access to doctors around the world, to patients anywhere in Africa. Because we've actually noticed that, most people in Africa have difficulty accessing doctors, quality doctors when they need. And you may be aware of it already. According to the World Health Organization, Africa faces the world's most dramatic public health crisis. You mentioned the high rates of HIV/AIDS cases in Africa, right? So, 60% of the world's HIV cases are in Africa, despite the fact that it only has 12% of the population. And you have an increase in non-communicable diseases. You also mentioned that, like diabetes, heart disease, and things like that. So the burden of disease is really, really heavy in Africa, yet there's a shortage of physicians. There's a shortage of physicians, namely because of the exodus of doctors trained in Africa into other parts of the world. So they left behind a huge void, which is really difficult to handle for patients, because they're having difficulty accessing doctors whenever they need it. So that is why we set out to build a platform, sort of a service to enable patients, people anywhere in Africa, to easily connect with doctors anywhere around the world whenever they want to. So that's what we built.
So I have a question. So you talked about the shortage of healthcare professionals on the continent. So there are two questions that arise out of that for me. Number one, how are you then getting the diaspora, the African diaspora, who are in the healthcare practitioners, let's say in the global north, be it UK, US, Canada, wherever, to participate? That's question one. And question two, does your platform make room for education and training of more people in Africa to kind of fill the gap? I'm going to say more, but I don't mean doctors per se, but even healthcare allied workers, which are necessary to kind of support the doctors that do exist. So let's take the first question first, which is, how are the African diaspora healthcare professionals being included in your project?
Okay, so that's a great question. And that's been our primary focus initially when we were looking for doctors to join the platform. We actually intentionally set out to talk to those doctors of the diaspora. In fact, I traveled to Paris to meet with doctors, African doctors practicing in France, for French-speaking ones, obviously. I also, I was in the US a couple of times and had a chance to talk to some of the African doctors practicing there as well. And all of them, without any exception, all of them were absolutely delighted to be able to participate in this, because they are quite aware of the dire situation back on the continent.
So before I go to my second questions, while we're on this question, is what countries are you actually active in right now?
In terms of providing access to care to patients,
yes,
we are currently present in 8 countries: Nigeria, Ghana, Sierra Leone, Liberia. Those are English-speaking countries.
Yes.
And we've also rolled out equally into 4 French-speaking countries, namely Cote d'Ivoire, Cameroon, Senegal, and Mali. So in total...
Okay, so you're basically only in the ECOWAS states.
Yes, mostly ECOWAS states, although Cameroon is not an ECOWAS state.
Oh, really? I thought it was an ECOWAS state. It's Central Africa.
Central West Africa, correct,
okay.
yes.
Okay.
So, we obviously, because we're based in West Africa, there's a sort of a natural tendency to start where we are and closer to home. But the intent is actually to make it available everywhere across the continent.
Well, that makes sense. And to come back to my question about healthcare training, we're talking about providing solutions that can, number one, be scaled, and number two, that can move towards what I'm saying has to be a sustainable system. We know there's a youth bulge. So is your platform currently doing any sort of training, or do you contemplate that your telehealth platform will also be able to, at some point, be able to provide training to kind of mop up some of these young people who are coming out of school in Africa with no jobs, but again, we don't have enough training schools? How do you see that evolving?
Well, the telehealth platform we provide is primarily to provide medical services. doctor consultations to patients. But one of the other activities we actually focus on is providing telemedicine solutions to governments. We've rolled out our solutions in a number of countries in Africa here, namely Nigeria, Zimbabwe, Kenya, Cape Verde, and so on. And we're pursuing that in other countries as well. Part of what we do also is provide the platform for these various countries to enable remote healthcare education for folks here in Africa to connect with professionals anywhere around the world. Mm-hmm. So that's sort of the what we're doing in terms of enabling that or facilitating that that possibility, but sort of driving the education of healthcare workers itself. We have not ventured into that, but it's actually something that's much needed.
Well, as I'm thinking about and hearing you, you're saying you're working with the government. So let's step back from that. The fact that you're working with some of the governments already, and the governments are to a large extent responsible for education, right? So might there not be an opportunity when you think about it? Might there not be an opportunity as you think about this for, even with the doctors that you're providing to the platform now, might they not begin maybe some CEUs using that platform to the local doctors, because they're seeing people, but let's say the person needs some in-country practice. If you're not yet doing surgery, for example, online, or I should ask a question, are you doing surgery online at this point?
No, not at all. It's all app-based, so it's for acute care, really. So it's not something that requires a visit to a hospital.
At this point in time. But let's say, for example, you've seen a doctor based in New York, whatever, and the doctor says, well, you need to do some tests, right? Does your relationship with the government allow that doctor to, quote unquote, prescribe a test in country, and then, in other words, prescribe a test in country that, let's say, the government's insurance will cover, because again, this doctor is not really practicing. So how are the, let's say, some of the nuts and bolts about the system being thought through to really make it scalable?
That's a great question, and a complex one as well.
I'm an engineer, that's why I do this. I know what the whole ecosystem is.
Yes, and for good reasons, actually. On our platform, what the doctor is capable of doing at the moment is actually during the consultation or after the consultation, they can write up their notes, their sub notes with a treatment plan and recommended lab tests to perform. And also they can actually write a prescription for the patient. And so the patient can actually, go to a pharmacy and using an electronic version of it, or maybe as a PDF form, and request medications. For the lab tests that are recommended, the patients can also walk into a lab and request the service. Now, in terms of how to get the government and insurance companies into the fold, it's a step-by-step process.
Yes.
I think that there has to be a regulatory framework in place that sort of grants or maybe permits telehealth consultations to be reimbursed by insurance companies in individual countries for one, and in all countries in Africa for in perspective. So I think we're going to be working with countries in which it's possible. The technology itself is not a problem. I think that we can build in the possibility for the insurance coverage to be accounted for in the services that are provided. But it depends on whether there's a regulatory framework that really defines how that works.
Well, I would say then that you're in a good position as one of the drivers, since you're one of the first companies to actually have a practicing system in place that does have overseas doctors participating, that you are actually in a possibility that you could maybe benefit, and it's probably a very terrible word to say, but benefit from this current crisis in which we find ourselves, where we now recognize the importance of having a digital solution for healthcare. I mean, Africa's always known they have to go this route anyway, right?
Okay.
But
Of
part of the
course.
challenge we know has been, just getting our act together because we just move slowly in our countries. But now we have this pressure to move quickly. You might find yourself the ability now to actually lead a conversation as opposed to waiting for it to happen, leading a conversation about creating this space, creating these regulations. And by the very fact that all the countries you are operating, or most of them are in the same grouping, perhaps it's something as a private sector person in the healthcare space, you could form a sort of partnership. Is this kind of thing possible? I mean, have you found that the doctors on the ground are amenable to working with you? How have you found, beyond the government, do you find that there is, let's say, in civil society and in the pharmaceutical industry on the ground where you are in Cote d'Ivoire, in these countries, is there a willingness to collaborate more closely to drive change in these countries?
Yes, I think, you actually asked many questions, and I'm going to try to address them individually.
Yes.
To your last question, though, there's really been a positive response from healthcare workers, doctors here, in Africa. In fact, we have a few of those doctors on our platform.
Mm-hmm.
We do have 40 plus doctors currently from different countries.
Mm-hmm.
So they're open to it. I think the only issue is really getting the government to define the policy around it. Now, to the first question about leveraging the current crisis to sort of, be at the forefront of defining the policies, I think you're absolutely spot on. In fact, in Cote d'Ivoire, we are in discussions with the government, the Ministry of Health specifically, to work out a solution to address the COVID-19 pandemic with the telehealth solution as well. But I think overall, though, the urgency of the pandemic should not blindside, the fact that, telemedicine or telehealth should not be looked at in silos, right? It has to be part of an overall digital health policy or strategy of the country.
Exactly.
Otherwise, it's going to be just, delivered as a siloed, technology, and it doesn't help the system at all. I think as we're addressing the current issue, obviously we know that with both doctors and patients confined, it makes total sense to have a telehealth solution immediately so that people from home can connect with doctors from home. But I think the larger conversation has to be, what is the e-health policy of the country, and how does telehealth fit in that entire ecosystem?
Well, I've been reading that in terms of budget cuts, there have been severe budget cuts around external donors for healthcare. I think as of last year, 2019, 50% of Africa's health budget was coming in the form of grants and donations.
Right.
So we're talking about really a huge gap. So I guess one of the first questions I would ask is, telehealth policy and a digital healthcare policy, first of all, requires better infrastructure, better power. We have been challenges even having this conversation since on bandwidth issues, on power issues. How do you see any solutions around that? In other words, do we have to wait until there are actually distribution systems running wire to wire, across hundreds and thousands of miles? Or have you seen the energy sector coming up with solutions for remote villages that can actually support this thing? I mean, what is happening on the ground?
Yeah, so I think, you touched on two things that have always been said to be obstacles to telemedicine in Africa, power and, and network availability. And it is true that, we actually had issues with power outage earlier, as you remember. It's a reality in most African countries. And I think if that's addressed, and that's why I'm saying that telehealth has to be part of a overall e-health policy, which should involve other ministries or departments, energy, department, for example, to ensure that, there's a sufficient electricity everywhere where people, need to have access to the technology. And, in terms of network coverage, overall in Africa, I have to tell you, there's really no big issues because mobile networks have become really ubiquitous everywhere, you know. And with a 3G or 4G connection, with the advanced technologies today that are less bandwidth intensive, it is possible with the mobile networks coverage today to be able to provide the service in a decent manner. So I have to say, I've been here 4 years, and it's amazing how, you know, the debate over network availability has evolved and is no longer really a problem. But I think power outage is one. And in terms of making sure that there's this, you know, sort of a comprehensive policy, I think technology alone is not enough, right? So you need to look at, you know, a whole host of other elements that will sort of enable digital health to take off. You know.
What about the issue of payments right now? Are you benefiting from the fintech, you know, movements in the region to deal with that aspect of the company?
Yes, you know, we actually are heavily relying on, you know, some of the novel, you know, fintech companies to provide us with a gateway of payment, gateway capability that, you know, really is suitable for our market. You know, as you know, mobile money is pervasive. It's everywhere in Africa. Most people don't have a Visa or MasterCard. So you need to make it possible for people to pay using mobile money and anywhere. And the challenge with it is also that, you know, you have networks in each individual country. So you need to be able to sort of navigate all the different networks in each country to provide a seamless service. Yeah. So it's a challenge that we actually are addressing somehow.
Yeah, and as you think about it, what popped into my head is the issue of remittances. How are you allowing remittances, healthcare remittances, to kind of subsidize? So, for example, I'm living in Paris. I want to pay for my auntie to see a doctor in Paris. How does that happen?
Yeah, so we are sort of considering a partnership with a company that provides that type of service, namely, you know, people in the diaspora being able to pay for medical services for their loved ones back on the continent. So obviously, we don't want to reinvent the wheel, but we're looking at integrating with their system to enable people from abroad to pay for medical services for their relatives back in Africa.
Well, if you were able to do that, please, you call me, because it's one of my pet topics I've been talking about for the last 5 years. As we draw to a close our conversation, and we could go on forever because it's really a fascinating conversation. Are you optimistic or pessimistic or neutralistic? I should say you're probably optimistic. I'm going to assume.
I'm definitely optimistic.
Because we wouldn't have putting your stake down on the ground and started a company if we're not optimistic. So that's not kind of a stupid question, but I think I had to ask it anyway, so put it for the record. You're very optimistic that this telehealth is going on?
It's if there's a time where I'm absolutely optimistic is right now. I mean, I started this 4 years ago with lots of skepticism, and people were probably wondering if, you know, this was ever going to be a reality. But, you know, we launched this last year, and we've seen some traction, and it's novel, but people actually kind of like it when they try it. And it's actually sort of, you know, an eye-opener for most. Now, coupled with the current coronavirus pandemic, it's just absolutely the right time for people to really pay attention to telehealth as the solution for them to access, you know, quality care whenever they want. So from that perspective, I think it's going to be, the interest is going to be growing. I think at some point it's going to become the default way for people to get care. And then if they are, you know, if they have a complex issue that requires a visit to the doctor or to the hospital, then they can make that decision. But I think that as we go further, people would actually consider telehealth as the first option going forward.
So as you say, you see going forward, I want you to jump into 2030, which is where I began. The SDGs are something near and dear to my heart. I truly believe that each and every one of us should be doing something to advance the SDGs. So I think your company could certainly be one of the SDG advancers, right? So I want you to tell me in your own words, 2030, as you think about your company, your contributions to healthcare in the West African region, what is a positive aspirational headline that will read that has happened because of your work?
I think the headline I can think of would be something like Africa's clinic. Africa's virtual clinic has become a reality, right? So the thinking here is that we would actually build a system in which all of the people in Africa will be able to have access to doctors anywhere around the world, and seamlessly will completely remove the notion of borders. So Nigeria, Cote d'Ivoire, Ghana, Cameroon doesn't really matter. All you need is just a doctor and a good one. So you can actually go to this platform and have access to any doctor anywhere you want. So that's sort of the headline I'm looking at.
Well, I think that Africa's virtual clinic has become a reality and has serviced its 10 millionth patient, 10 millionth patient.
Right.
I'm gonna even jump into the millions from now. It's
Absolutely.
something I want to intend for you in 2030. Thank you so much for spending some time with me, YAYA MBAOUA, and talking about your vision for the MBAOUA Group and Africa's Virtual Clinic 2030.
All right. Well, thank you so much, Claire, for having me. It's been a pleasure talking to you, and thanks for giving me the opportunity to share my thoughts with you.
So that's it, folks. We just want to say we have come to the end of this very insightful conversation on healthcare futures in Africa. I thank you for joining us on Future Sense Now, the Futures Forum live online, where we explore salient ideas for sustainable futures. Remember, the future is embedded in the landscape of today, so seize the future. We create the future today, even in these times. So until next time, as we say in Jamaica, safe journeys.
All right. Bye-bye.
Thank you for listening to Future Sense Now with Dr. Claire Nelson. Future Sense Now is produced by the Futures Forum in Washington, D.C. For more information, visit www.thefuturesforum.org. Remember, our futures are embedded in the landscape of our present stories. Seize the day, share this story, and share the future.